guys, I said I'd upload another video tonight, so that's what I'm doing. Okay, so before I get started, the book that we are using to reference is Medical Surgical Nursing, Assessment and Management of Clinical Problems. It's the 9th edition by Dirksen, Heitkemper, and Bucher. So I just want to make sure to say that, you know, all the lab values and information that we're using are coming from that book. And then I throw in, you know, kind of my additional experience, opinions, and some information that I've picked up along the way. Okay, so as a nurse, it's your job to report abnormal lab values if they're critically high or low to the doctor. Yes, they do look at them, but you need to know, okay? So one of the first things that you should do when you're a nurse, you come in, get your assignment, and you want to get a good clinical picture for this patient. Look at their lab values, what's high, what's low. That should give you indicators of what's going on, especially if they're being newly admitted on an acute floor. Okay, so the most important concepts related to labs that you really need to know are what is the lab values, the normal ranges, what is the actual test itself, what does it mean if labs are high or low, okay? It's very important. So I thought that we would start with some of the most important ones. One of the first things you're going to pick up on in nursing school is white blood cells. They will ask you questions on lab values, especially for class, for your lecture, when you're actually in the nursing program. And I'm sure you have some basic knowledge prior to getting in about a little bit about white blood cells, red blood cells. They're going to get very detailed. But the answers or the questions that you're going to get, like for your boards, say you have some sort of question that uses white blood cells, it will never be direct. They'll be incorporated into some maybe clinical question. So they might say you have a 55-year-old female with a white blood cell count of 15, a whole bunch of other symptoms, and they might give you some other information to try and throw you off a bit, and then they might ask a question, what disease does this patient have? But even that is a little bit too direct. It'll get a lot more complicated than that. Okay, so what you need to know about white blood cells. If you're just starting, if you're a fresh nursing student, the abbreviation is WBC for white blood cells. Get it in your head now. It's the first letter of each word, okay? WBC, white blood cells. Also referred to as leukocytes, which is something you definitely need to know. Let's just write it right here in red. Leukocytes. Okay? In the medical field, that's what we're going to refer to them as often. If you have a patient with low white blood cells, think of leukopenia. Okay? Leukopenia. And if they are high, leukocytosis. Alright, but back to the top first. White blood cells, WBC. Okay? It's the measurement of total number of leukocytes. So we want to know how many white blood cells does this patient have throughout their body. Gives you a good idea, generally, of what's going on with the patient. The normal range, according to this textbook, is 4 to 11. Lab values do tend to vary facility to facility, but this is their range, so that's what we're going to use. When I was in college, my professor followed 5 to 10. But it usually only varies slightly. So they're not going to say generally like 12, for example. They will give you a little bit higher of a number, okay? Because everyone's aware that they do vary a bit. All right. Leukopenia is what we call it if your white blood cells are low, so meaning lower than 4. So think 1, 2, 3, anything less than 4, leukopenia, okay? And it's little tip here, anything that starts with leuk from here on out, L-E-U-K, is going to be referring to white blood cells. It's related in some way. All right. So if you have decreased lab values for white blood cells, if they're low, some of the reasons why that would be, you would be seeing that, they have bone marrow depression, severe chronic illness, or some types of leukemia, which can throw you off a bit. So for the most part, forget about that one. Bone marrow depression is big. So you got to think critically on this one. Why would someone have bone marrow depression? Someone who has bone marrow depression might be going through chemo or radiation. That's a very, very big one, okay? Cancer patients that are going through chemo or radiation have bone marrow depression and they have very low white blood cells, okay? Which kind of eliminates their ability to fight off infection if they get too low. Now, going to the other end of things, high values. So higher than 11. Anything higher than 11, according to this textbook. Reasons for your white blood cell count to be high would be infection, malignancies, inflammation, or tissue injury or death. So for malignancies, sorry, I wrote that in the wrong column here. It might be lymphoma or leukemia. So, perfect example of the leuk thing. Ooh. Leukemia would be related here. Leuk. Okay. So it's a cancer involving white blood cells because it's the start of the word. This is how a lot of medical terminology begins if you're just learning. Starts with leuk. Okay. So if a patient has, for example, pneumonia, that's a perfect example of an infection where your white blood cell count might go up, okay? Inflammation. All right, something like wow, I'm a moment here.